let me know if you can't hear me or anything. But so we're going to be talking about elder abuse, elder and dependent adult abuse today with, remind me how to say her last name.
Kuykendall.
Anabel Kuykendall. She works for the County of San Diego, Health and Human Services, and then in the Division of Aging and Dependent Services. So she's going to be our expert today talking about the elder and dependent adult abuse. But first, we'll just quick overview. I'm going to do an overview of elder help, introduce elder help a little bit, and then I'm going to pass it off to Anabel, and then we'll save some time at the end for some questions. So if any of you are new here, Elder Help, we are an organization here in San Diego, a nonprofit that helps older adults stay in their homes and live independently. Our mission is to help seniors remain independent and live independently in their own homes. We do that through personalized services and information. So we have a number of different programs, including a volunteer driver program to take seniors to like their medical appointments or any social activities. We can help with things like grocery shopping, organization of mail, paperwork, or just organization of the home, or just a friendly visitor. And all of our programs are intended to reduce social isolation and any resulting health and medical issues. So if anyone has any questions about elder help, please go ahead and let me know. I will put my contact information at the end. But with that, I'm going to go ahead and pass it on off.
Okay, thank you. Good morning, everyone. We're so glad you could join us today. I just want to say it ahead of time, if from time to time I have to pause. I have bad allergies right now, so if I have to, we might just have to pause for a little bit. Maybe Dana could just kind of say something while I'm doing that. But as she already said, I'm part of the Outreach and Education team at Aging Dependent Services, which is our Health and Human Services agency under the County of San Diego. And I think most of you are aware of our huge County of San Diego vision called Live Well San Diego. We have three major components: building better health, living safely, and having thriving communities. And of course, today's topic will focus on the safety component of that, because we want to really provide you good information and some resources when you might come across with this type of situations, because we do know elder dependent adult abuse, unfortunately, is more common than what you would think. And it is, sometimes people find it hard to talk about, and it's a topic that a lot of people might get upset, but we really want to provide you some good information, education, and also find out the different programs that could actually help. So you don't feel alone. Especially, we know there's a lot of caregivers out there, whether it's your own family or people that are really just, that's their main job, is to provide caregiving services. We want to give you as much information and education at this point. And then do we just,
the arrow right here.
Arrow? Okay. So we are in the state of California, so I just wanted to give you the definition of what an elder and dependent adult is. And I'm not one of those who will read every single thing in the slide. You actually could see all of the information in front of you. So as long as someone is 65 and over, then that person is considered a senior citizen, older adult, mature adult. And then we have folks that are not quite seniors yet, but they fall in the category of 18 to 64. So they may have a disability, and that disability could be temporary or permanent, and it could be physical or mental. So when you really think about it, anyone who's 18 and up, if they meet the criteria, then you should always look into inquiring about our services, our programs at Aging Dependent Services. Today's topic will focus on adult protective services, obviously, but please keep in mind our AIS, our agency, has a lot of programs where we serve those who are very independent all the way to those who are very dependent and might need more help. And so in this particular situation, there's a lot of older adults that are probably needing to get connected with us because they have all kinds of different issues going on at home and they need additional help, and such as professionals and other community agencies like Elder Help, we collaborate with a lot of folks to make sure that we're all doing our job to give the best service to the folks in the community. Also, on the bottom of the slide, you will notice we also need to know where the person resides. So if they're living in their own home, are they in a licensed facility? Are they an inpatient 24-hour facility? This way, when you're referring people to us, we have an idea where they live so we know which program are actually going to be the best program for them to be referred to. Penal Code 368 is just basically a definition that a crime has been committed towards the population that we just mentioned. And depending on the severity of the situation, it could be a misdemeanor or a felony. So that one's very much pretty straightforward. We also want to remind folks that at any given time, abuse can come across in different ways, and you may witness it, you might hear someone talking about it, or someone might tell you that they're concerned about someone. So now if you have knowledge, you're kind of concerned about that person, and maybe yourself, you're struggling because maybe you're a caregiver and you're feeling like you're alone and you're doing your best, and then you're getting to the point you might be getting burnt out, and you might be taking your frustration on the person. So we want people to understand that any given time you can access our 24-hour hotline, which is the APS hotline is 1-800-510-2020. That's the San Diego County number, that's toll free. If you're calling from 619-858-760, then that will definitely be the best number for you to call. However, we realize most folks now are relying on their cell phones. They may not have a landline. So if you're going to refer to APS San Diego County and your area code is outside 619-858-760, we recommend that you call 1-800-339-4661. I believe it will be on the last slide of our the presentation, so you will have that number again in front of you. But the most important thing is, as permissive reporters, that means you could always make the referral to Adult Protective Services anonymously. Everything is held in confidential anyways. For us professionals like Dana and I, we are mandated reporters, so it is our legal responsibility to make the report if we suspect any of the abuse that we're going to go over in a little bit. So that's the most important message I really want people to understand, is that you only have to suspect. And then if you feel like you're not sure if it really is abuse or not, that's why our toll-free number, our hotline is available for you. So you could speak to our workers on the hotline and they could help you sort it out and go over everything with you, and they'll let you know if it is reportable to APS or not, or maybe simply what you're providing to us could be a person who needs to be referred to a lot of services for caregiver, respite services, or support groups, that kind of stuff. So they're there to help you navigate the system and provide you as much information and referrals. To also give you an idea when we get into the different types of abuse, we want to spend some time about the profile of someone who is a suspected abuser. Unfortunately, it's very consistent with all the data that's coming in our referral system, and when we do our investigation at Adult Protective Services, most of our abusers, perpetrators, are family members. They are related to the victim. And if they're not related to the victim, that person is usually in a position of trust. So it could be any professional, or I'm just going to mention some examples. It could be their own caregiver, and not to say all caregivers will do abuse, because we do know there's so many different things where there's intentional and unintentional abuse, so we need to also make sure we understand that there's a difference between those two. But it could be their own financial planner, it could be a home health worker, it could be someone that might have been hired by the family member. They set up a homemaker agency worker to assist with some of the services at home, and then all of a sudden that person decides to quit the agency they work for, and now they're just going to go on their own, but the family members and maybe the senior has no idea that they already parted ways with the agency, and then now that's when they're going to start doing some abusing, exploiting the older adult, or the dependent adult. So we really want folks to understand that, it could be anyone, but unfortunately it's usually someone who knows the in and outs of the person's schedule, what their needs are. So we want people to understand that it could be anyone in the family, so there's other families that may not be aware, so it can get very chaotic, but that's why you want to refer those cases to us. So leave it up to APS to go ahead and investigate and make the determination what else could be done. So as you can see in all the different types of profile here, it's also important to point out that a lot of our abusers, alligators, have a history of alcohol, substance abuse, and or gambling addiction. And that makes it more realistic why they're very emotional and financially dependent on the victim. And at some point they want to be in full control. So what we're going to do now is turn it over to the victim's profile, their characteristics, and you can see as you read through this list of traits of our victim, very common. They could deny it, they could contradict it, they could change their mind. And we have to also always remember that a lot of times they're very afraid, and it's realistic for them to be very afraid, because they don't want any other retaliation, or when the person leaves after they talk to the victim, they might be afraid that they might be more prone to physical abuse, for example. But what we want is to get the referral and let us go out there and do our job. We want to make sure that people understand that we will always provide privacy, so we want to do one-on-one interviews, because we know we're not going to interview the victim and the suspected abuser in the same room, because the victim's not going to be saying much, it's going to be the alleged abuser. So we just want you to understand that these are all possible characteristics of our victims, so we need to be mindful and sensitive to that, because they are going through a lot, especially with whatever abuse is going on. We also want to point out that we do have a very diverse community, so we want to provide appropriate translation service to all of our clients, because we want to make sure we provide them the best information and they understand our roles, and that they also understand that there are laws here that will protect them. And this type of cases, it's really important that we have to be patient, because we need to build rapport with them and let them understand that there are laws here that protect them, and they don't feel like they have to be isolated and no one else can help. And here is the actual definition, according to Welfare Institution Code, what a caretaker, caregiver is. And this person assumes a lot of responsibility and basically is in charge of the care, custody, control, and stands in a position of trust with the population that we're talking about. So an individual might be a caregiver for more than one person. Could be multiple people that they're providing caregiver services, but at the same time, we want for folks to realize that this is a very challenging job for most people. There's some of us who are doing it not being paid because we're family members. I also want to point out that there are plenty of us that are in the sandwich generation. And if you haven't heard that terminology, a sandwich generation is someone who is caring for their aging parents and then also have kids or children that they're caring for. So that's why it's called sandwich generation, because they're kind of sandwiched between those two generations. So you could just imagine the demands of the responsibilities that come along being a caregiver, caretaker. This is an important job for everyone, whether it's you're doing it on your own or you're getting paid, because it's a lot of responsibilities. And what you're signing up for, you need to make sure you understand your duties so you can carry out your responsibilities, and that if you ever feel like you need any help or you are getting overwhelmed, that there are services, programs all over the county that we could assist you if you need support services, respite care, or just, maybe get together with a bunch of caregivers because you want to know, maybe you could learn so much from other folks that what you're dealing with is not you. A lot of people have been there, done that. They could provide you a lot of guidelines and recommendations for problem solving as well. So here we go. We're going to go over the different types of abuse, and you will see that there's 8 of them listed here. I'd like to really point out to you, I don't think I included this in the slides. I just wanted to give you the information that are data from fiscal year 2016-2017. So that means fiscal year starts on July 2016 and it ends in June 2017. So the referrals that have come in our hotline was about 14,700 plus. I don't have the actual numbers in front of me, but I can remember you some of the key numbers. And out of those, over 9,800 plus were handled, investigated by Adult Protective Services. And out of those 9,860 that APS actually handled, financial abuse is the most common type of abuse, followed by mental suffering and physical abuse. You will notice there's neglect by others, isolation, abandonment, and abduction as well. I also want to point out self-neglect is also listed here. It's not against the law, but especially for us mandated reporters, we really want to encourage folks to still call in, refer folks that you think might be self-neglecting, because you never know, out of that one phone call, you could make a huge difference in that person's life. And maybe we could start them off with one simple service and then build on that. And the good news is, at least there's another program, a set of eyes and ears that will come out and check them and to see if there's anything else we could do. Okay, so trying to take a deep breath as I'm talking. So physical abuse, these are just some of the key things that we want you to think about. Keep in mind that there's so many different things that fall under physical abuse. Of course, there's always the obvious things like bruises, skin tears, bite marks, grab marks, but there's so much more that fall under physical abuse. We're looking at maybe the person's basic needs are not there. They're being deprived of just as simple as their food, shelter, and clothing. Unfortunately, domestic violence and sexual abuse is also underreported in this population. And like I mentioned to you earlier, their perpetrators are their own family members. So we also have to consider that we have a lot of folks that may not want to disclose or say anything because they don't want their own family members to get in trouble. But our job is to really get out and see these folks, because we need to protect them. We want to make sure they're safe, and if they're not safe at home, we need to work with other agencies and collaborate with everyone so we can make sure that their well-being is protected, and that of course, the person who's committing the abuse will go ahead and have the proper consequences. So we want people to understand that physical abuse comes in so many different um, ways, but it's not just limited to bruises because there's so much more. One example I could tell you could be a family member who's very frustrated because they have someone, a caregiver in place for their aging relative, and yet when they visit them, uh, they don't look like their hygiene is being, they haven't been showered, their personal hygiene is pretty bad, their clothes are dirty, and then they're starting to wonder how come they kind of look just kind of catatonic. Maybe the caregiver is not doing their job because it could be the person might be getting paid, and when they're there, they're not even doing the proper, shower, give personal care to the person. Maybe they're giving them like a sleeping medication so the person will just sleep all day and they could get paid doing nothing. And of course, we're going to look at other different things that could happen once they start neglecting and also they start not doing their job, because there's so much more that will make the person more in a very bad situation. So this one is just the different types of physical abuse. And then we're going to move towards neglect by others. And of course, obviously, this is the definition that you see on the top, is when we will go ahead with the neglect allegation if the person failed to provide any of this specific type of things, like not being able to properly provide nutrition, meals to the person. When you see in this slide right here, what if the person looks malnourished or dehydrated? If they have a caregiver, someone looking out after them, they should be able to eat on time, and of course they have to have the proper diet. They look dehydrated and malnourished, then you're starting to question neglect and what their role is in that household. Simple things like, again, the personal hygiene, their clothing. How is it safe at home? Is it very, chaotic? Too much trash, dishes that have not been washed for a long time, and moldy food. Is the person able to get the proper medical care? Are they going to the doctors? What about their medication? So we're looking for all those specific things, and if we find out that there's a lot of this type of duties not being done by the person who's in charge for the care of this individual, then that's when we're going to go over the neglect allegation and confirm that there is abuse. And just to give you some other indicators of neglect, there's some different things you need to keep an eye on. Bed sores, again, could happen anywhere, at home, in the hospitals, but we just want you to know that it comes in different stages. For example, a bed sore can start as small as the tip of a pencil eraser, but if it's not treated properly, it will go on stages, and the worst kind of stage 4, the cubitus, that's when it's really rotting and it's really a severe form of neglect. Believe it or not, our APS workers have gone out there and seen the worst kind of bed sores. So we need to get there in time so we can get the proper medical care for these folks, because there are times it's so severe that the person will not survive that type of severe neglect. You will also see that there's untreated or unexplained injuries. APS is always looking for consistency when it comes to this type of allegation. If someone, well, back in the day when I did case management, if I question a client of mine saying, I noticed you have some bruising on your body, and of course the client will say, I have poor balance, I fall a lot. And if I notice that the bruises are on the outer part of the body and it's consistent to the type of fall that they're telling me, then I'll believe it. But if their injuries are in the inner part of their body, grab marks, bite marks, the type of injuries you don't get when you fall, then that's very questionable. They might just be saying that to cover up for someone, or they're afraid to tell you the truth. Poor oral hygiene is important too. If the person, for example, looks malnourished, and then you question a family member or caregiver saying, how come my mom looks like she's losing weight? Are you not feeding her, giving her her meals? And then the caregiver could say, yeah, I give her her meals, she doesn't eat it. Well, maybe she doesn't eat it because, first of all, it's too hard for her. What if she needs her dentures, and when you give her the food that you don't give her dentures? Or if the person needs to be on special diet, they need something soft, and you're serving them something with, heavy steak meat, and that could also be a choking hazard, a safety issue, so they might not eat it. So those type of things are something to consider when you're noticing some changes in their weight, their personal care. You're going to start wondering if this person is really taking care of your loved one, or doing their job. Of course, depending on the time of the year, we want to make sure that they have proper clothing. If it's too hot, it's too cold, do they have a heater? Or, we want to make sure when it gets really in the hot summer months, when it does get hot in certain parts of the county, we want to make sure the person has a way to cool themselves, and make sure that, we want to avoid heat stroke, dehydration, because if someone's being severely neglected, then a lot of these things will happen to the person, and then that's when they could get really, really be in bad shape, and sometimes it might be too late for anyone else to help this person because they were severely neglected. So again, this is just to give you an idea of other indicators of neglect. So if you have any questions later on, let us know. You could always go and type in a message on the chat, and then we'll get into it. So isolation, this one's pretty much self-explanatory, and basically it's the person wanting to just cut off any kind of contact the victim has. Could be other family members, or maybe they have neighbors, or even volunteers that like to visit them. All of a sudden they'll say, oh no, she doesn't want to see anybody today. She's not feeling well. She's not here. So all kinds of excuses, even different ways to try to reach them. Phone calls, letters. They may not even read the letters you're sending them, or maybe not getting the messages because they're actually making sure they get the messages and they read the mail. So the bottom line is it's just false imprisonment, because they don't want anyone else to find out what's going on, and they want to be in full control. And now we're getting to self-neglect. And with the self-neglect clients, we have two types of self-neglect clients. The ones that are easier to actually help and more open to our services are those who realize that they're getting frail, they need more help, and they're very happy to see that another agency or a number of agencies are working together to give them the best recommendation. Unfortunately, the majority of our self-neglect clients are the proud, stubborn, self-determined. This is my life. You're not going to tell me how to live it. So I'm sure you could think of a bunch of people right now that you could think of, even maybe some neighbors or family members that you think might fall in this category. And like I mentioned earlier, it's not against the law, but us mandated reporters, as well as you want to do your due diligence, and why not refer it to Adult Protective Services? And APS may or may not do a lot, but at least we're going to go out there, and then if we could get other folks to come in and help us, assist us, then at least you know that we are going to see the person and then provide them some recommendation. But we do want you to understand that we have to respect their decisions because they do have the right to refuse services. We'll get into that in a little bit more, but I just really want folks to understand just because you referred it to APS, for example, I wish our investigators come in with a magic wand, but it doesn't happen that way because it's never black and white with a lot of our referrals, especially with the self-neglect referrals. It might take several referrals before they could even say yes to us. So doesn't mean one referral will take care of it all. But remember, when we close the case on a self-neglect referral, and then down the road, 6 months to a year from now, you get another referral, at least this way, whoever the investigator who's going to be assigned to that case, they have a way to look at the history and maybe, oh, this person's been seen before. So now we have history, and then later on down the road, nothing else could be done. But now a couple years went by, and then they're noticing the person now looks like they're having memory problems, maybe possible dementia. So now we could start looking into getting other folks to step in and assist them. More indicators of self-neglect. I'm just going to give you some time to read that. I'm sure you've seen some of the things that have been highlighted in the TV, in the news, where you will see a lot of folks frequent fire code and animal violations. There's some hoarding going on around there. It could be an object or an animal hoarding. And remember, that becomes a safety issue. So when it's all said and done, whether the person will change their behavior or not, but if you feel like because of their serious hoarding, it's a safety issue, at least call it in, and then we could get other folks to step in and maybe help clean their place. Or also you could see in here, looking to see if they're even have capacity. And then are they oriented to person, place, or time? But you have to realize a lot of our folks in this category, they do have the capacity, they just don't care. Is this a lifestyle type of choice for them? So it's very filthy, chaotic, and so we just really want you to understand that, this is very much a lot of the referrals we get in our hotline, but just know that APS did respond to this referrals, but you just can't assume that, oh, they didn't do anything. Well, we did our best, but we also have to also make sure we respect their right to refuse, because they do have that right. And this is why we have to be careful with that, because we might have the best services recommendations that we could provide to them, but they can say no because California is a self-determination state. What that means is that the person has the right to make bad decisions, even though not to the best of their own interests right at this point. However, if there's only certain criteria that we could get folks to step in when we know that they are a threat to self or others, and maybe we could say that the person's gravely disabled at great physical risk, then we can also get mental health clinicians to come out. We have our program senior team. We also have PERT, Psychiatric Emergency Response Team, and law enforcement can step in and do a 5150. 5150 means a psychiatric hold up to 72 hours, and that requires a mental health clinician to make the determination for 5150. Our APS workers will refer to these folks if needed. Okay, now this is a big one, financial abuse. The actual definition is right in front of you, and as you can see, for a felony offense, it only has to be an accrued sum value of $950, so that's not much. And it comes in different forms and indicators. These are just some of them, and as you know, this is not the complete list, but we just kind of captured some of the most common ones. And please keep in mind, we didn't even factor in fraud and scam. And those are additional types of ways, whether it's a stranger or a family member or person you know, could financially exploit our older adults and people with disabilities because they are taking advantage of their vulnerability, especially if they're isolated. They don't have a lot of support system, but they know they have some kind of income, benefit, retirement, pension, or they may own a home. They're going to target them and try to gain their trust. You will notice here on some of the things we listed in the slide, it doesn't have to be money. It could be falsifying documents. Maybe all of a sudden their wills and trusts have been changed. It's a new person that you've never heard of. Changes in property. Sometimes a lot of our older adults get tricked on signing forms and they don't realize they signed away the deed of the house. And then missing items. It could be jewelry, it could be they're stealing their checkbooks, writing checks. There's that loans and gifts in quotation because they always feel like, oh no, I gave that money to my grandson. You know, oh no, I just loaned that money because they're going to pay me, but to the point that they're not going to pay them. Remember what I mentioned to you, most of our abusers have the gambling, substance abuse, and gambling addiction. This is why financial abuse is so common because, again, they are going to try to be financially dependent on this population. And what happens is, you will see on the very bottom, because of the severe financial exploitation abuse that's taking place, now it's going to put the person at dire strait, whereas lack of funds for basic needs, where maybe they can even afford to pay their rent, their mortgage, or their utility bills, because now their money is gone, or maybe they thought they paid their bills, but then the person stole the check, and SDG&E, for example, never got the payment because the person might have just changed the check and made it to their name and cashed it. So there's so many different things that people can be financially exploited, so we want people to understand if you're noticing a lot of changes in their financial, if you have access to that, then you want to question it. And if you have access to their accounts, and of course the person needs to give you permission, or if they put you on their account, you know, it's a good idea to contact the banks, the financial institution, and let them know that there's some charges or some excessive withdrawals that you're questioning. And you have to keep in mind, someone who might be suffering from memory loss, dementia, Alzheimer's, you know, they are very much very vulnerable when it comes to financial abuse, because some folks will definitely use that as a way to say, no, she never gave me that money, she's making it up. Remember, she's forgetful, she's confused. So keep in mind, those are things that they will try to use and excuse their behavior, because if the person does have memory loss, dementia, Alzheimer's, they feel like they could get away with that. And we're almost done. Oh my gosh, look at the time. Okay, we're almost gonna wrap it up so we could allow any other folks to ask us any question, or if there's anything else we need to provide for clarification. Abduction basically is removing from our state or restraining them to come back to California, and you will notice financial abuse is the primary reason for abduction. And mental suffering, these are the harder cases to prove. It becomes he said, she said type of things. It's intimidating behaviors, it's harassment, threats. It could be a simple threat like, okay, grandma, you better give me some cash so I could buy some beer next door, or else I'm not going to take you to your doctor later this afternoon. Or it could be, I want your ATM with your PIN number so I could take money out so I could go gamble at the casino. So they are going to intimidate and use this power and control just to make sure that the person will go ahead and give in. We do understand that, a lot of our adults, they do realize that maybe their family members do have this kind of problems, whether it's substance abuse or gambling, for example. But if they're competent, they're giving the money to them freely, you can't just say, well, I'm going to call APS. APS is going to go out there and tell them not to give the money. We can't do that because they do have the right. They realize most of the time that, they're giving their money to their loved ones, but it's going to be used for something else. But we don't have any right to say that to anyone because remember, they are competent. They can make bad decisions, and all we could do is provide recommendations, but they have the right to say no to us. And abandonment is when we will make our APS workers will respond to specific cases if we could get there in time, obviously, because sometimes people move around and we can't get to the location that the person said where they normally see this person. But we have had folks abandoned and found in shopping centers, bus stops, hospitals, facilities, where they were just basically placed there and then no one else is going to pick them up. Obviously, if it's in a different situation, like out in the community, out in public, you should always call 911 because emergency responders can get there sooner. And if they need to cross-report to APS, for example, then they will go ahead and do that as well. APS program are the folks who will investigate allegations of abuse with the different types of abuse that we went over just now when the person is living in their own home. However, I also want to just briefly mention to you that when the person is residing in any of this type of facilities, and you can see there's so many different types of licensed long-term care facilities, our ombudsman program is the program that will go ahead and will have jurisdiction over these folks that are residing in this type of facilities. I believe their 800 number is the next one. There you go. It's a different 800 number. They're available Monday through Friday. If it's after hours, you could always provide it in the answering machine. The APS hotline, however, is 24-hour hotline, and you can access that any given time. 724. And what happens when you refer to APS? We usually do unannounced visits, up to 10 days to do the face-to-face visit. I mentioned to you earlier, we'll make sure that they have privacy when we interview them, and we're going to assess their vulnerability, their risk factors, and their capacity. It's important for us to know what's going on. Once they're done with the investigation, confirm when they close the case, meaning confirm there's abuse, inconclusive, not enough, and unfounded, there's no abuse, then that's how we move forward with closing the case. And there's more than most of the time we have to do a lot of collaborative partnership with so many different agencies with this type of cases, so that's why we put multidisciplinary team consultation, because once we get there, we usually find out additional services and programs need to step in. And of course, we'll do our best to make recommendations and referrals. APS is short-term crisis intervention case management, so the main thing is trying to address the safety and well-being of the victim, and then once they close the case, they're going to work with other services and programs to make sure that there's long-term care services in place for them. And sometimes, we might have to turn into placement because the person's no longer able to stay at home or the best option for them is to be in a facility. And just other programs that we normally will work with and closely refer to, that's also still, a lot of these are County of San Diego programs. The public guardian, public conservatorship program is available. The senior team I mentioned to you, these are our mental health clinicians. They serve folks who are 60 years and over. You could also call the 800-510-2020 if you think that is a referral that needs to go straight to senior team. Psychiatric emergency response team is there. I also want to point out you are not alone. The YANA program, this is a wonderful service that our community senior volunteers are providing to different parts of the county. They are the ones that will visit folks, homebound seniors, and they'll visit them face to face. Some folks, they visit more frequent than others depending on their situation, but I could not give enough shout out to our YANA program, because if you know someone does not have a lot of family members or support system here, this will be a good program to connect our wonderful folks out there so they could get a nice friendly visit with our senior volunteer program. I just spoke to a group of volunteers in Rancho Bernardo. A lot of the volunteers would like to provide this service some more, but they feel like they could use more referrals. But it's not just in Rancho Bernardo. We just want, if you're a professional or a family member, if you know someone could use this wonderful program called YANA, please call our number and we could direct you to those specific locations on how you can get that person be visited by our wonderful volunteers. And then the rest are just different types of services and programs we work with, just so you know, because a lot of times the person might need to be referred to home delivered meals or maybe other volunteer opportunities. I know Elder Health has a lot of wonderful volunteer opportunities as well. As caregivers, you're looking for different services. We could refer you to a lot of different agencies that provide services for caregivers. We also have our Caregiver Coalition programs group here in San Diego County. So we really just want folks to understand that, there's a lot of services, but if you could at least reach out to us, and of course 211 is always available to provide you a lot of information as well. You could just call one of these numbers and then we could get you connected to the right folks. Oh, here you go. I did include it. I thought for some reason I didn't, but I know in the beginning I mentioned to you that these are the latest statistics we have for APS. So I want to give you some time to look at the numbers. So when you really think about it, if you do a simple mathematical computation, there's only 12 months in a calendar year, fiscal year, and we've gone over almost 15,000 referrals. So that's over 1,000 referrals coming in to our hotline. And you're wondering, well, why is it 14,741 and then there's only 9,872 cases handled? You have to understand when the referrals come in, some of those referrals might be appropriate to other programs. It could go to ombudsman, or it could be for senior team, or it could be a referral directly to our in-home supportive services program. And other types of cases might be something out of our jurisdiction for APS because maybe that person moved, they're in a different county, they're in another state, so now someone else has jurisdiction over them. But it's consistent that financial abuse is the most common one, and followed by mental suffering and physical abuse. We also wanted to just give you some basic community resources, especially as caregivers. We want you to have some key numbers to remember. And I mentioned to you on the APS hotline, the 800-510-2020. Remember, if you're calling outside the San Diego County area codes, please remember the 800-339-4661. Because if you call our 510-2020 number and you do not have an area code in San Diego County, there will be a delay getting that referral to go to APS San Diego County, because that's definitely will be routed to Sacramento. The most important thing is for us to get your referral as soon as possible, so it could get assigned to APS, and then our workers could go out and schedule the visit. But Aging and Independent Services has so many programs and services to offer. So it's also available Monday through Friday for information and assistance. We will connect caregivers, family members, and folks that need services and possibly need to find out if they're eligible for our programs. And then if they can't qualify for any of our programs, that's when we will connect you to a lot of our different community-based organizations, nonprofit agencies, just so we know that someone else can go ahead and provide you the service you need. And then there's Access and Crisis Line, available Southern Caregiver Resource Center. For those of you who are dealing with family members suffering from dementia and Alzheimer's, for example, we wanted to give you the main numbers for Alzheimer's San Diego, as well as Alzheimer's Association that covers San Diego and the Federal chapter. Okay, I think at this point,
We'll leave it open to
we'll leave it open. We have
questions for the last few minutes.
time for any questions.
I have a question.
Okay.
So for someone that has dementia, how do you prove either mental suffering, physical abuse, or any kind of neglect?
What do you mean, how do you prove, like when you make a referral?
So let's say I were to refer someone and I think that the caregiver is neglecting them, either not.
And the person has dementia?
Yeah.
Okay.
Yeah. So how would you because obviously you can't interview that person and say.
Yeah, what we'll do is basically, depending on the information we get once the referral is provided to EPS workers, hopefully there's additional contacts that have been given. And then, of course, the reporting party, since that person's the one that gave a lot of information, more than likely they're gonna say, they could call and collaborate with you and say, okay, so these are the allegations, anything's happening. And then maybe we could get a way for trying to contact the doctors or additional family members if you have that on file, and maybe get to the point that who has power of attorney, do they have an advanced health care directive? Because once that person has that diagnosis, someone else has to be responsible for making decisions for them. So it's important for us to really find out all the different folks who are involved in that person's life and then get them connected. And then whatever other steps we need to do, then we'll definitely meet and talk to them. And of course, the person who's guilty of the abuse and neglect, we need to take care of that, because that person should not be there. And they will work with, again, if a crime has been committed, then we'll definitely have law enforcement, and then all the way to, we work very closely with the DA's office, so prosecution. So it just depends on the severity of the situation. Okay,
Let's see, sir.
Let's see.
Can you give us an example of house?
Okay. Other than abandonment,
okay.
can you give us an example of how severe must the abuse referral be in order for an APS representative to involve law enforcement?
How severe the abuse referral in order? Well, here's the thing. So remember, you may have suspicion of allegation of abuse. It could be physical, and you're thinking it's severe. But you're just suspecting that you don't have a lot of proof at this point. What we'll do is you make that referral to APS, and then APS will do their part. And then depending on whatever the outcome of that investigation, they can move forward in getting law enforcement to get involved. Because remember, we have to cross-report to appropriate entities, especially when a crime has been committed. It could be, if you think that right away, it is a crime, then you could always call law enforcement, and then law enforcement can also cross-refer to APS and get other folks to step in. So this one is kind of one of those kind of questions. It just depends. And when you say, does it have to be severe in order for APS to get law enforcement? It just depends on the outcome of their investigation. So that's why it's important the referral comes into us, so we could go ahead and go out and do our investigation, and then we will go ahead and get other folks to step in if needed, and what else needs to be done, especially for the safety and well-being of that person. Hopefully I answered your question, Pablo. And this is a good way to also remind folks. I mentioned to you it's never black and white, right? So that's why our hotline is there for you to go ahead and talk to the social workers on the hotline. So let them make the determination if you have enough to get it to APS. If they say, you know what, based on what you're telling us, this one is not appropriate for APS, they'll give you that. They'll clarify that with you. They might say, oh, this person is more appropriate to be seen by our senior team program. So they will. And they're there to help you problem solve and also make sure that the appropriate services, whether it's from us or with another agency outside AIS, because it's important for us to make sure that when you call us, we give you the best referrals and all the programs that they're eligible for. Because there's a lot of times that people don't even know where to start, or, you know, the person has no income. How do I get them to apply for Medi-Cal? They need some assistance. Maybe we could get them connected to our CalFresh program. Or we need someone to maybe do a friendly visiting program, or someone to help with the grocery shopping. So we will look at our database and all the different agencies. For example, Elder Help will say, oh, based on that person's address, Elder Help serves that area, or maybe shared housing. So our call center staff are there to help you problem solve and also take the referrals when you're calling in. So please remember the 800-510-2020 because it serves as a call center, information and assistance, as well as an APS toll-free number for 24 hours 7 hotline for adult protective services.
For a caregiver that is, their loved one doesn't live in California, what's the best protocol for them to, who do they contact? Is it just always their area agency on aging, law enforcement?
That's an excellent question. So let's say, for example, their family member, older adult, they're in another.
Yeah, like if they live in San Diego.
But they live in San Diego, their
Yeah.
family members outside. What we always tell people is, since Aging Dependent Services is the area agency and aging designated AAA here for San Diego County, because the person is outside our county, obviously what we'll do is when you call our 800 number, we will give you the number of the actual county, which is the area agency on aging for that particular person's address, and then give you their number. Okay. So the family member here who might want to get their loved one connected to the same similar services like ours here in San Diego County can go ahead and start getting in touch with them and find out what programs they have available. Because each county has different programs. Some may have less, some may have more. We're very fortunate here in San Diego that we have a lot. And there are times where family members are saying, my mom and dad live in back east, but you know what, I want them to move here. So I need you to help me problem solve, navigate how I can get all their services transferred here, or what are the services that I can look into once I get them to move here. So a lot of times it's just trying to get the ball rolling and then connecting them to the actual other aging services that are available outside San Diego. Okay.
And the definitions of abuse, the different types of abuse, are those nationwide definitions? Are they just San Diego County?
Well, this one is all based on the Welfare Institution Code, which is based on the California mandates. So every state may or may not have an APS program. So it's always important to go online. I know if you're interested in finding out more the different types of adult protective services throughout the county, a good one is when you Google it, you could put NAPSA, NAPSA, and then there's like, it'll give you some key things about the maps of the whole United States, and then you could see the different types of APS agencies available in those states. So it depends. Some places, their APS might be under another aging services. Us here, obviously, you will notice we have a lot, and we're just very fortunate that we have a lot of laws that protect our older adults and people with disabilities, but unfortunately I can't say the same thing for other places because depending on how small or big the county is. But you could start with us, and then if it's outside our jurisdiction, then we could connect folks to other state and county programs.
Yeah.
Yeah,
It's helpful
always
for
good
a
to
lot.
know.
Do we have any other questions? I think that was the one that came.
I think it was only covered.
Okay. Well, I will go ahead and put Elder Help's contact information up here real quick. If you have any other questions, please feel free to email me and I can pass it along to Annabelle. Or if you have any questions about Elder Help, of course, you can give us a call or email us. But thank you so much for being here today.
Thank you.
I think this
My
was really
pleasure.
helpful.
Thank you all for joining our webinar.
Yeah.
So hopefully you've learned something today. If not just those numbers, keep it in mind. We just want you to feel comfortable calling us for information or referring people to us because it is really our responsibility to care for the folks in our community. So we're all here to help, partner, and collaborate. So we're just glad that we could do this today with Elder Help. So thank you for having me.
Thanks everyone. Hope you have a
Thank
great
you,
rest
everyone.
of your
Have a
day.
great day.